COM103 Lab 2. So in Lab 1, we enter doctors. So for this lab, we're going to enter in customers, aka patients. So there's going to be up to 4 print screens that I want for Lab 2. So they're listed on the board for number 1. So head of household, allergy tab if there's any, drug tab if there are any, and then the disease tab. So let's go over some of the common pitfalls. So quick code, same for the doctor. We'll just use the initials. Don't worry about using their birth date here as their quick code. We'll just use their name initials. For RX eligibility, now if you're the card holder, we're gonna put not specified, but whoever's coverage it is will put that. So if it is your spouse, we'll put significant other. Your partner, will put significant other. If it's your mother or your father, dependent parent. If it's your child, then dependent child. Right? So if it's yourself, not specified. If it's significant other, partner, sig other. Patient residence, our default's going to be home. So if it doesn't say, we're just going to assume the patient's at home, unless they specify location, hospital or nursing home. Easy cap button versus safety cap. So this CP in the drop-down menu will let you toggle through safety cap or easy cap. So make sure you change it there. The person prepping the drug may not know. So you got to put it in there for them to know. Once we put in the patient info, then we're going to go down here to the tabs. So we got allergy tabs, drug tab, and disease tab. So most important thing is you'll double click on the new icon down here. You don't want to do the new icon up there because that'll open up a new patient. You want new here for the new allergy. So when you go to drug, click here for the new drug. Disease, click here. All right, so here is a sample. So this is the patient. So you'll enter all the information in, but once you get to here where it says family, they're going to get you to the head of household. So when you type in the name and push enter, if it's not in the system, then you'll need to add it. So it's pretty easy. It's going to give you the head of household screen, which is this one. No, never mind. Which is this one. Sorry. So the one that says family, that's the head of household. So this is the person that is the card holder. So they're the one that's probably working, paying into the premium, and then you will be covered under it, the spouse, the child, or in this case, the dependent parent. So the head of household is Matthew. We'll enter in his address and phone number, but the notes are not for the head of household. The notes are for the patient. So you just need the address and the phone number here. And then just save it, close it. It'll bring you back to the customer. And then this is where you'll put the notes. So the notes is for the patient. Patient is hard of hearing. So the patient here is Fong, and I am a dependent parent as stated in the lab. All right, so let's enter this guy in. So the book's going to tell you to do a bunch of searching, but we know these are all going to be brand new patients. So just click your customer button and then just go ahead and do new. So in the lab 2, it'll take you through step by step. So read through everything. I'll just highlight the main steps. So on page 8, we are at step 6. So you can skip all the searching. We'll just enter in a new patient under Shedlock Mary E. Birth date, so 0303 1906, 030 1960? Oh, 1960. 1960, there you go. Quick code, we'll just use their initials. Don't worry about entering their birth date. Pay type. So if they have insurance, we'll put insurance. If it's cash, we'll put private. Private just means cash. So that's pretty cool. We don't have to run it through insurance. We just charge them the cash. All right, this patient, what do they want us to check in step 10? Female. So Mary will be a female. All right, family. Is customer also head of family? That means, are they the card holder? In this case, no, right? So if you read through step 11, it tells you no, they're not the head of household. The head of household is Matthew Shedlock. So is customer also head of household? You're gonna click no, and then you're gonna type in Shedlock, Matthew, so they assume the same surname. And in step 11, it's just Matthew, M-A-T-T-H-E-W. And then once you push enter, right, Matthew is not in the system, so we'll need to add the head of household. Right? So just click add head of household, yes, and it'll bring you to the family tab. Right? This is where you're only going to enter in the address and the phone number. Remember, the notes are for the patient. So we'll enter in the street address, 1386 Quincy, Q-U-I-N-C-Y Lane. And I'll try the zip, see if it enters. 02134, kind of weird. All right, so Massachusetts, Alston's in there. And then the only thing you need to add is the phone number, step 12, 703 464 0100. This is it. The notes, remember, are going to be for the patient. So if you want, you can print screen this and put it to your Word document. Once you're done print screening, all you gotta do is click save, and then when you close it, it'll bring you back to the customer. And then this is where you'll put in the notes for step number 13. Patient is hard of hearing in left ear. Oh, so this is case sensitive. Patient is hard of hearing in left ear. So you don't want to put anything that the patient might see in here. So if a patient gives you a lot of trouble, then you might want to put in there high standards. That was our code word for very high standard patients. Insert any other adjective you want. Driver's license, so identifier, they gave us driver's license. If it's different, you can just toggle through and change it. 057915228. So that's step number 14. Step 15, this is the RX eligibility. So as specified in the lab, this is a dependent parent. But just take a look at the choices available, not specified if it's themselves. Full-time student, up to, now it doesn't matter, up to age 26. So here we'll just put dependent parent, significant other for spouse, partner, etc. Place of service, pharmacy, and then patient reside at home. So for us, home is default unless otherwise stated. Childproof option, CP. So if you need to change it to easy opening, change it to easy opening. Just double click. This one, CP. How many labels? One. Just one label. So if somebody needs a duplicate label, we'll put 2 or 3. All right, so now we're gonna enter the allergy tab. So go down to here. So we're in allergies. So the new icon, make sure it's the new one down here and you double click on it. So once you double click on it, we're gonna type in drug allergies. So this one is only drug allergies that you type in. So we'll do morphine. So double click and then just start typing MOR in the name field, MOR, and it'll bring you to the area where morphine is. So we can just do the one that is regular morphine. Click OK. Next, we're going to go to other drugs. Everyone's able to find morphine okay? No? Kind of? All right.
Yes.
All right, other drugs, same thing. Double click on new. And then for this, leave out the date and the quantity. So we just have to put in the correct drug. So we're looking for vitamin E 400 soft gel. So just start typing VIT and then scroll down until you're at the correct vitamin. So you want vitamin E 400 capsules or soft gel? Soft gel. So make sure you select the soft gel one, 400 units. And then don't worry about the date. Mine's not even showing up, so just, that's fine. Just as long as the drug name is there, you'll be fine. And then lastly, for disease profile, very important that you double click here in the new icon. And then when you start typing the disease name, you have to look for it under the medical term. So if it's a common term, then try to find the medical term for it. So in this case, it's diabetes. Is it letting me add? DAA. All right.
It says you gotta click on the tab to make the red blue. No, I clicked, yep.
There you go. Okay, so get the highlight off and then start typing, right? So we are looking for diabetes. Is that right? No? DIA? Why is it not typing on mine?
Mine says the
Click on it and hit F2.
F2. All right.
Or hold down the function.
This is so weird. Huh? There you go. All right, so a little bit new. So that was step 27. All right, so once you click new, you have to click function F2 and it'll bring up the list. And then just start typing diabetes, DIA, and then scroll to the correct one. So we want just diagnosis. Well, just diabetes.
It's just diabetes and no
Mellitus. So we'll just use diabetes mellitus. Scroll down. Insipidus. There you go. So nothing specified, just regular diabetes mellitus. Highlight it. Click OK. That should be it, right? All right, so before you save, go ahead and give me the print screen. So if you forgot the family, click here for family, and it'll just bring up the family for you again. So print screen this guy, that's your first one. And then activate the allergy tab. Just print screen, show me that you added here. Give me a print screen with the other drug, and a print screen with the disease. So up to 4, family, allergy tab, other drug, and disease tab. So once you're done with your print screen, then go ahead and click save, and then go to page 13, and you'll have the additional patients to add. So for us, just go ahead and click new, and your next patient is Ray Rule. So just remember last name, comma, space, first name.